Good afternoon, everyone, and welcome to the Multicultural Media Online Forum hosted by New South Wales Health, Multicultural Health Communication Service, and New South Wales, Multicultural New South Wales. Today, we're pleased to have the Honourable New South Wales Premier Dominic Perrottet, and also Minister for Multiculturalism Natalie Ward, and the Senior Medical Advisor of New South Wales Health, Dr. Jan Fizzell. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and we're really glad for you to be here today. We'd like to begin by acknowledging the traditional owners of the land from which we're all meeting today. We pay respects to elders past and present and extend respect to Aboriginal communities, colleagues, and elders. We also acknowledge the elders from all multicultural communities represented today. We would please like to request if you can please turn your microphones off, as we only have 30 minutes until 4:30. For any updates and questions you'd like, please go on the chat and we'll try to answer them. So we'll begin. Premier, how are you today?
Very well. It's great to be here with you for my first time as Premier.
It's great to see you. Any opening remarks that you'd like to share to the multicultural media?
Yeah, well thanks. I mean, I think our government has always been a great supporter of multicultural media because you are very, very important in helping us serve the communities that you speak to. And just this week, I was at the Australia Day Awards on Monday, and I spoke about how important the many cultural communities of New South Wales are to our national identity, along with our Indigenous and British colonial heritage. And this year's New South Wales Australian of the Year, I think, is a great example and testament of just that. Professor Veena Salaswala. She was born in India, migrated to Australia, and is now a nominee for the Australian of the Year. And as important sources of information and news for culturally diverse communities, I really do believe that you can play an important role in uniting our state and our nation. And I want the communities that each of you serve to share in our state's success. I want to thank everyone for the work that you've done in keeping people safe and informed during the pandemic, because it's been a very difficult time, but that's made even more challenging in certain culturally diverse communities. And I really want to say that each of you have played an important role in helping us turn that corner. And as somebody who was on that crisis committee the entire time, we always thought this would be a real challenge, because it had been a challenge in Victoria and a challenge around the world. And the success here is your success, and we couldn't have done it without you. I think you've really made us have the capacity to turn what was an immense challenge into a great success story for the state. And those public health messages, which we obviously tried to relay consistently during what was a very difficult time for our state, was incredibly important. Sharing those messages to cultural leaders, to religious leaders, really helped keep people safe during that lockdown period, and has really helped get that vaccination rate up. LGAs like Campbelltown, Canterbury, Bankstown really led not just New South Wales, but our entire country when it came to that vaccination rate. So I really want to thank you for the work that you've done. It's been a difficult period, but I come here today for my first time with you with a lot of hope and optimism. And I think that we've got a lot to look forward to, and particularly those with communities who have ties overseas. We're going to start to see reuniting families as borders open. And I've already seen some of those fantastic scenes at the airport, and they will only continue to welcome as we welcome back travellers and international students. We're opening the door to migration, which I'm working closely with the Prime Minister on at the moment. The recovery plan that we put together just more recently has a lot of support for households and businesses, and I want to make sure that financial support is accessible to every single person in this state. And so if there's any thing that we can do from a government perspective, obviously working very closely with Minister Ward to get that information out, please let her and my office know, because that's very important to us. So in conclusion, I say my commitment today is to keep working to make sure that Australians from all cultural backgrounds continue to be part of our state's success. I know that Minister Ward will be making an important announcement about combating racism. Can I commend Natalie for everything that she's been doing? She's an exceptional advocate for multicultural communities right across the state, and I look forward in my capacity and role as Premier to work with her to continue to serve you and secure a strong recovery for the communities that you look after. So thanks very much. It's great to be here, and then I'm happy to take any questions.
Thank you so much, Premier. And a lot of the media, multicultural media, are excited because they've sent through a lot of questions. But before we go to the questions, we'd like to introduce Minister for Multiculturalism, Natalie Ward. Minister, how are you today?
Hi, Jess. I apologise. I've missed our weekly get-togethers, which have been fantastic. I apologise for the noise. There's a division going on at the moment. So what I might do, Jess, if it's all right with you, is go back on mute, perhaps go to some questions to the Premier while we have him until the bells finish ringing in my chamber, if that's okay with you. We've had this before, I know, and I appreciate your patience. Thanks, everybody.
Thank you so much, Minister Ward. And before we go to the questions, Dr. Jan Fizzell is here, our Senior Medical Advisor. Any quick updates today?
Just to let people know that New South Wales recorded 231 new cases of COVID-19 in the 24 hours to 8 o'clock last night. Across New South Wales, 94.2% of people aged 16 and over have received a first dose of the COVID-19 vaccine, and 91.3% are fully vaccinated. Of the people aged 12 to 15, 80.7% have received a first dose of COVID vaccine, and 73.9% are fully vaccinated. If you haven't had your COVID-19 vaccine yet, please don't delay. Even if you've had COVID-19 and recovered, you should still get vaccinated. We're encouraging everyone who's eligible to book into a New South Wales vaccination clinic or another provider without delay. There's over 3,000 places to get vaccinated at the moment. And if you are asked to get tested for COVID-19 or self-isolate anytime, do follow the self-isolation rules. And if you're directed to get tested, do make sure it's a PCR test taken at a drive-through or a clinic, not one of the tests that you can get at the supermarket. If you've got any COVID symptoms, no matter how mild, get tested immediately at one of our drive-through clinics or at one of the clinics, and self-isolate until you get that negative test result back, even if you're fully vaccinated.
Thank you so much, Dr. Jan. And Premier, that's exciting news. We have a great percentage of vaccinated people in New South Wales. Great news. Now, there's a question here from Keith Tan, Chief Executive Officer of the Australian Chinese Daily. He says, do you expect staffing shortages as a result of the vaccine mandate for teachers in New South Wales? How will the New South Wales government address this?
Oh, look, it's a challenge, but so far I don't think it's as substantive as it's been made out. So as at 9 a.m., for example, today, of the more than 121,000 school staff out of just 137,000, Jess, had reported their vaccination status. So that's incredibly pleasing. And that also includes the casual and temporary staff. So that makes puts us in a position where minimal disruption will occur for our students. Now, that's over 98% being fully vaccinated, and just over 1% have a medical exemption or are not vaccinated. So I look at where our teachers are at the moment. 97% of them, 79,200, told us their vaccination status, and over 98% are fully vaccinated. So the department continues to follow up with less than those 2,500 teachers. It's only 2,500 over all the schools we have right across the state. So, look, it will be a challenge, but I don't think it's as substantive as it's being made out. And we'll also be in a position to analyse where we see gaps and be able to address those going forward.
Thank you so much, Premier. There's a question here from Fred Zhang, chief journalist from Sydney Today. On behalf of the Chinese community in Sydney, he'd like to ask one of these questions. With increasing numbers of schools impacted across COVID in New South Wales, what is the New South Wales government doing to ensure the safety of children and the community?
Well, just a great question, because obviously our number one priority is to keep people safe, particularly our kids safe. And in circumstances where many of our young people who are at school have not received or had the opportunity to receive a vaccination. Now, obviously, that's not the case for high school students, and we're seeing very good numbers in that space. Now, from time to time, there will be, unfortunately, a situation where we might have to close schools temporarily. That will create some inconvenience for parents, but it's ultimately better that we have schools open than have them closed. So what occurs in those circumstances, New South Wales Health make a determination. The schools will be, if there is a COVID outbreak at a school, And in those circumstances, there'll be a cleaning occur. I've already had one of those schools in my electorate at Epping West, and the feedback that I had from the parents that it went very smoothly and the school was open again. So these are difficulties and challenges, but in the scheme of life and what could have been, I think it's a much better position that we're in now, where we're opening up from time to time when these situations arise, we address them. Certain students might be identified as close contacts, there'll be greater restrictions in that space, but ultimately our fundamental responsibility in this pandemic is to keep people safe. I think so far we've been able to do that. And unfortunately, that means from time to time there are inconveniences, but I can say on behalf of the health team and the government and the education team, we're doing everything we can to minimise any disruption at all.
Thank you so much, Premier. Minister Ward.
Hi, I might jump in there. Thank you so much for your patience once again. I'm back. You can hear the bells aren't ringing, so if it's convenient, I might jump in at that point. Great. Yeah, it's great to be with you all. Thank you. Yeah, it's wonderful. And it's wonderful that in these weekly media conferences we've had with our wonderful multicultural media community, that we have the Premier here. And I know that he and I share a very strong commitment to supporting our wonderful multicultural community. And it's been such a privilege to walk by your side throughout this journey and during the pandemic and as we emerge. And it's just been wonderful as we've listened, we've responded, and hearing your direct feedback about what is needed as we move out of lockdown and back into normal life has just been magnificent. So thank you. As the Premier mentioned, we have a vaccination rate of more than 90% now, so that we can focus on that next chapter, which is really important because that continues to feature our wonderful, harmonious community here in New South Wales. Today, Jess, I've got a very exciting announcement about one of the future programs. I am delighted to announce that the future of one of our essential youth initiatives has been secured once again. The New South Wales Government has committed to our $13.4 million program until mid-2024 towards the Community Partnership Action Program. I know many of you know this, it's the COMPACT program, the Community Partnership Action. And that will ensure that those further projects can be supported in addition to the existing 15 compact initiatives that we have, which promote social cohesion and our community resilience. And these important projects, as many of you know, connect our young people with mentors, with community leaders. They get youth work specialists together through those networks and forums and events. And we know how successful they have been. So we're really proud to announce today, Jess, that we're supporting that to continue, because they support those youth to stand up against those social injustices, to become active volunteers, to take charge of issues in their community and to improve that social cohesion that we know works so well with their support. Already we know the Compact program has reached tens of thousands of young people across New South Wales, which is so exciting, particularly through our schools. And as part of that funding, applications for a new round, $1 million round of Compact grants opens today. So I encourage you to get that out to your communities and through your channels and in language, because that package also includes $800,000 over 4 years to expand and strengthen the fantastic online communications initiative that we have, the Remove Hate from the Debate program. And we know that keeping our young people safe, keeping them communicating is more important than ever, because we have seen some of those levels of harmful materials emerge online. So it's really important. I'll finish up on this, Jess, that we empower those young people with the tools and the resources to speak out against online hate and utilise their voices to promote those positive messages of community harmony that they do so very well. So very excited to announce that today. Very happy to provide more information. Of course, that is, as always, through Multicultural New South Wales. And I thank them for their support and look forward to working together with everybody to promote those programs. Thanks, Jess.
Thank you so much, Minister Ward, for that great announcement. And it's good news. And of course, we'll share those information shortly to the communities and media. We have a question, Premier, from Ahmad Salim, editor and manager of An-Nahar newspaper. We have seen a steady decline in case numbers and deaths, which is a great result of New South Wales. Would you like to comment on this success?
Yeah, well, Jess, the success isn't the government's success. The success here has been the efforts, the extraordinary efforts that people right around our state have made to go and get vaccinated. I mean, we, in those committee meetings, if you go back some time, we were looking at much higher hospitalisation rates. and much lower vaccination rates. So the fact that the vaccination rate has reached the levels it has ensured that as we've opened up and mobility's increased, we've been able to get businesses open again and people back to work and getting to our state back to a level of normality again. Has that success is on the people of New South Wales. It's not the best one of the greatest vaccination rates in the nation. It's one of the best in the world. And therefore, when what we did expect early on in relation to hospitalisation rates, ICU presentations and deaths has not been anywhere near where we thought that would be. Having said that, there is a long way to go. We're opening up as we open up, and we'll have another set of restrictions that are lifted on the 15th of December. There will be challenges that come ahead in 2022, particularly in circumstances we head into those winter months next year. So this pandemic is far from over. We're doing everything we can to encourage booster shots as well. So we're keeping our vaccination centre at Homebush at this stage open. We have closed Kudos and opened up a new vaccination centre in Granville, and that will provide an opportunity alongside GPs and pharmacists for those booster shots to be taken up. So we have still a long way to go here, but to date, and I know you kind of live in a world in politics where there's a lot of negativity around, but if you go back through and back to where we were at the start of last year, and we were in a position where we recovered most of the jobs that had been lost last year. We actually recovered more, where we've kept people safe. We've had a very low death rate and low ICU presentations. In those circumstances, I think New South Wales has done incredibly well. But as far as I'm concerned, we're still got a long way to go. We're still got to be vigilant. We're still going to have certain restrictions in place, but at the same time, we've got to learn to live alongside the virus. But to the question, the success is not our success. The success is on every single person across our state who's made an enormous effort to go and get vaccinated and ensure they look after themselves, their families, and their community.
Thank you so much, Premier. A question here from Reverend Alimoni, or Moni, who is a Pacific Island leader, to Dr. Jan. How the Pacific community have responded to the vaccination campaign by New South Wales government, given that you've done a lot of community work?
Look, I think we know that many of the Pacific people in the Pacific community have had some hesitancy towards the vaccine, and it's a real testament to the community leaders that they've been able to get the vaccination rates as high as they have. We've still got a bit of a way to go. There's a gap between the community rate of vaccination and the vaccination rate amongst specific communities. So I just thank all the leaders who've been trying to conquer some of the misinformation that's been circulating and have been encouraging really good COVID-safe behaviours through churches, through the media, and through lots of other platforms to help get the message out.
Thank you so much, Dr. Jan. Premier, a question here from the community. Many members of the community are concerned about how vaccinated and non-vaccinated family and friends can gather safely at Christmas time. What advice can we give them?
Well, I think still to be careful. And obviously the risk might be lower over summer, but, Christmas is a very important time, and you have a lot of gatherings and families come together, and that's just a wonderful thing. And overall, that's incredibly important because many people have, this is not just a health crisis, it's a mental health crisis too. We've had many people in isolation. We've had many people separated from their families and friends for a long period of time, and everyone's made enormous sacrifices in that regard. So I think Christmas is going to be a time of immense joy, immense happiness for many people as we kind of come together and celebrate a very important time of year. But at the same time, we need to make sure that we, continue to just be careful and look out for each other. And if we treat everybody with kindness and respect, we'll get through it. But ultimately, it's very likely that many of us right across our state are going to get COVID. And the key success to that is to get vaccinated. And has been pointed out by Dr. Jan, that most people have gone out and done that in great numbers. But at the same time, I also don't want to see, as we move forward into the future, a two-tiered society. But ultimately, those who aren't vaccinated, that it's not looking after themselves. And we've seen the evidence is very, very clear. When you look at the hospitalisation numbers, when you look at those who are in intensive care, it is very much skewed towards those people who have who have not been vaccinated. So my key message today would be to the media to continue those messages, please, because you've done an amazing job today in promoting that, as the doctor has said. So we can do that going forward. I think we're going to have a very happy summer. It's going to be a much brighter time than it's been over the last few months.
Thank you so much, Premier. A question here for Minister Ward. How is the New South Wales government assisting international students to return to New South Wales who have had to study online in their home countries during the pandemic?
Yeah, thank you, Jess. We've heard throughout the pandemic when we've been getting together about our wonderful international students. We are welcoming them home. Of course, there's such an incredibly valued part of our community. New South Wales is really proud to be leading the country with our pilot program to see our international students resume their lives in New South Wales. We're really keen to get them back here. So we're so excited that we have the New South Wales International Student Arrivals Pilot Plan, which is kicking off next month. That is open to all international students who are, of course, fully vaccinated with a TGA recognised vaccine. So they will be most welcome back, and we've made sure that we've really wrapped around them with that arrivals pilot plan so that they can have that accommodation in place, and we can make sure that we're welcoming them back and getting them back to their books as they should be and they want to be. Of course, last week we announced that returning international students won't be required to quarantine if they are fully vaccinated with that TGA recognised vaccine, which aligns with our quarantine requirements for returning Australians. And in very exciting news, Jess, the first flight on the 6th of December will be arriving with about 250 students from over 15 nations, and they include Indonesia and Singapore, Vietnam, South Korea, China and Canada. So we're really excited about that first one. And then, of course, there'll be a second one just in time for Christmas, carrying students from South Asia and India, which is due on the 24th of December. So they will return to their studies and we'll have those every 2 weeks from December throughout the pilot program phased approach. And I really want to thank everybody for coming together, because that's been a collective effort funded by industry with the governance and operational support of government agencies and the Australian government. So very exciting program, ready and willing and able to welcome them back, Jess.
Thank you so much, Minister Ward. Premier, there's a question here that's saying that from Hannah Zhang from ACB News, Chinese media, the COVID-19 economic recovery strategy released in October highlighted several objectives. The first objective is to secure a strong balance with temporary and targeted stimulus and support measures aimed at encouraging economic activity and to create more jobs for the people of New South Wales. Can you please know more details of how New South Wales government will help create more jobs? After the job savers and job keepers, are there any potential supports for business owners?
Yeah, well, there certainly is. And, you know, we've always said during this period of time that we're going to put the economy and people of our state before the budget. And, you know, we've come through what we've now invested over $40 billion in support measures during the pandemic over the last 18 months. And in the economic recovery strategy, it's all about ensuring that those who have lost their jobs get back into work as quickly as possible and the businesses remain open. We put $500 million to restore consumer and business confidence, and that includes the expansion of the Dine and Discover vouchers that we announced earlier on, which have been a real success and a favourite amongst many people and have helped people go out and support their local businesses. We're also expanding our Stay and Rediscover accommodation vouchers, so accommodation vouchers will be available for people. We're providing support for jobs and skills, which we allocated $250 million for, which provides help for job seekers to retrain or upskill. We provided over $200 million to boost vital sectors, including the performing arts sector and our Fresco Restart package, that help really encouraging businesses to open up and look at new ways of doing things and create culture and opportunity in local suburbs, and also bring our cities back to life. We put a substantial amount of financial support for regional New South Wales, over $200 million, including support for events, facilities, local infrastructure and housing. We put $75 million to boost communities, including support for tourism, events, sport and recreation. And also those areas that have been substantially hurt during the lockdown, we provided additional support there as well. So we're also helping with mental health support for those who have been doing it very tough. We've got a package as well, giving support for mums and dads who have been homeschooling during this difficult period of time, where from next year, they will also be able to access vouchers that they can spend on accommodation, tourism, and the like. So there's a lot in the package, and I encourage people to look at it online and see what's in it for them. But we want people to go out and enjoy the best that our state has to offer, support local businesses who have been doing it tough during the pandemic.
Thank you, Premier. And also those resources and information will be available in language for the community. We have a question here from Yeyi Wendy. Now that the children have not been vaccinated, the school diagnosis is a matter of great concern to parents. The vaccine for the children will soon be on the market. Will they be required to be vaccinated before they can go to school? I guess Dr. Jan and Premier, is that a question you can answer?
Look, we've been strongly encouraging the young people who have had access to a vaccine to get vaccinated, and it certainly causes a lot less disruption to their schooling and a lot less disruption to their families when kids are vaccinated. We do know that some small kids do get quite sick with COVID, not near as many as the young adults can get sick, but I think it will be an important thing to even reduce that small risk in kids potentially. So we'll wait and see what the TGA says about the vaccine, but again, I think it will promote a lot less disruption to families if children are able to be vaccinated.
Thank you so much. Premier, would you like to comment on for children to vaccination and getting children safe with vaccination?
Yeah. Just to add to that, I mean, the reality, particularly for high school kids, we've seen significant take up, and that's important. And obviously we'll work with the federal government, wait for the TGA in relation to younger children. So I actually had a conversation with the Prime Minister about that on Monday. So we're obviously in their hands in relation to at what point they deem it appropriate for our younger children to get vaccinated. But ultimately, whilst the risk of greater sickness is low, it ensures that we keep schools open, it ensures that we keep kids in the classroom, and it ensures that we keep kids and families safe. So we'll work through all those provisions, but ultimately, at the moment, for those who are eligible, who are generally high school students, or year 6 and above, and 12 and over, that they that parents go out and help their kids get vaccinated, because they can do that. That's going to keep their kids safe, them safe, and also ensure that we keep schools open.
Thank you, Premier. A question here. When we see the situation overseas, in particular in Europe, a lot of people hesitate to go there and visit their family. They're scared that the rules could change and make it more difficult to come back to Australia. Could Europe go on a red list? What is your advice for that question? That's from
Could you
Francis.
go on a what list? A wait list?
Yes. Could Europe go on a red list? And what is your advice? Should we stop? I guess the question is wait a little bit and see, or go now? So that's the question for people to travel.
Well, I mean, I can't comment in relation to what other countries and their positions are, but I can certainly say in Sydney and obviously New South Wales, but we've made it very clear that if you're fully vaccinated, you don't have to hotel quarantine or self-isolate. But if you go out and get vaccinated and you're keeping yourself safe and everyone in the community safe, then there shouldn't be those restrictions in place. So we're very determined to do that. I think, we can't live here in a hermit kingdom on the other side of the world. Being open ensures greater opportunity for our economy, provides opportunities for people to go overseas and enjoy tourism opportunities in other nations, but also as many of your communities know, that people want to go back and see their family. I've met so many people who haven't seen their families overseas such a long period of time, and I think it's one of the great things now as we open up, that we're also reuniting families across the globe.
Thank you, Premier. And it's 4:30, and I know that you have a meeting to go to, but would you like to say your final words to the multicultural media, and then we'll go to Minister Ward and Dr. Jan.
Just to say thank you so much again. I want to reiterate my point that I said at the start. Thank you so much for everything that you've done during this period of time. The media has played a crucial role in delivering those very important health messages that Dr. Jan went through, that have ensured some of the highest vaccination rates, ensured that the restrictions that are in place are well communicated, and they can be challenging from time to time, as particularly over the last 18 months, as they have changed from time to time. So the media has played, and each of you have played, a crucial role in conveying those messages. And that's been very, very important. So thank you so much for everything that you've done during this period of time and what you'll continue to do as we go forward.
Thank you so much, Premier, for joining us.
Thank you.
And we appreciate, and maybe you'll come back again next time. But Minister Ward, any last words for the media?
Yeah, thank you so much, Jess. As always, it's a great privilege and a pleasure to get together again. I'm very appreciative of the opportunity to speak with you again. Of course, I just want to reiterate the Compact program and commend that to you so that we can get that information out, and also say how important it is that we continue to walk together in this journey. And that's why we've put our funding behind multicultural media and the grants programs. That's why we're really keen to continue to get messaging out there. And thank you so much for all the hard work that everybody has done, the wonderful messages you've sent through, and the opportunities to get together once again. Thanks, Jess.
Thank you, Minister Ward. And Dr. Jan?
Look, I just want to thank everyone, particularly as we start to emerge from the pandemic. I think we know that lots of different people have had lots of different COVID journeys. So the importance of kindness and patience with each other as we move forward together as a community. Some people have got very entrenched views about different things, and I think it's going to be really important that we look after each other, we support each other. So help each other with the getting tested message. Make sure that if you've got symptoms, you go and get one of those tests at a drive-through or at a clinic. Look to help people who are unvaccinated, who may have been hesitant, who may have had a conversation with a doctor 12 months ago, help them have a new conversation with their doctor. We've got much more data about the vaccines than we did. Please get them vaccinated if you can. And again, just stay safe, look after each other, be kind, and get together safely outdoors.
Thank you so much, Dr. Jan. And thank you very much for the Premier, Minister Ward and Dr. Jan for being with us today. But want to thank you all. And also we want to ask for your feedback. The multicultural media, you have been so instrumental in our journey in making the rates that we've had, which has been successful. But we want to know if we've been able to work together in this journey and how your feedback in our collaboration together. So if you can, we have a survey and we're sharing the link now on the chat. So if you can, please participate and fill in the survey so we know and evaluate and also hear your feedback. Also, we will be able to send that link through to you as well. So thank you so much in advance for participating in the survey. The recording of this online session will be available on the New South Wales Multicultural Health Communication Service website. And for any questions that we have not been able to answer, we'll try to get back to you with those answers. But thank you so much for always being with us here at the Multicultural Media Online Forum. On behalf of the Premier, Dr. Jan, and Minister Ward, thank you so much. Stay safe, be kind to each other, and have a great day.